Welcome, everybody. Welcome to another Community Fit. Pardon me. And in particular, a midweek desk stretch, your class all about embodiment and kind of feeling better midweek so you can get through the rest of today and the rest of your week. We're going to be talking on working through shoulders and hips today, kind of continuing along. If you have any questions, feel free to drop them in the chat or the Q&A function. Specifically, while I'm doing some talking up front, if you're like, hey, I would like to kind of work through a shoulder or a hip thing around this, feel free to drop that in and we'll try to touch base on whatever that might be today. If you are just joining us for the first time ever, we have sort of a sequence we work through. We always start with some nervous system regulation work. And if you're like, I have no idea what nervous system regulation work is, don't worry. We'll kind of catch you up and you can follow me along. If you have been working with us for a while and you have a practice, by all means, do you take care of your nervous system in the way you know you need to take care of your nervous system at the top of this. And if you are interested in learning more about nervous system regulation, join us on Fridays for our Adjusting to Change Toolkit class, same time, same place, different link. So we're going to start off with that, work our way through some shoulders and some hip stuff, and get you out of here in about 30 minutes or so. I'm not seeing any questions or interests or queries coming in. So I think we're good to start. So get comfortable, whatever that means for you. I'm going to scooch back just a bit. You can see Bob, the dog, kind of sleeping right there. He got a haircut, so you'll see it's like big old head right now and littler body. So keep your eyes out for Bob. Um, get comfortable. Starting off with that nervous system regulation work. We've got about 3 to 5 minutes. Oh, there you go. He's like, here, you can have my head a little bit mixed in with whatever it is he's laying on. Go ahead and get started with whatever that means for you. I'm going to start off with some breath work for today. The breath work I'm going to start off with today is, I don't want to say more advanced, but it is definitely a more mindful and intentional version of breath work. If this feels wrong for you, go ahead and do whatever it is that feels right. An example might be just taking a short, quick inhale, long, exaggerated exhalation. The breath work I'm going to guide us through today is called listening for breath. And it requires you to kind of pay attention to your own breathing rhythms. I'm going to get us started. And then after a bit, I'm going to not guide you on this because if you're doing it to my counts, my rhythm, you're not doing it to your count and your rhythm. And part of it is kind of adjusting to what feels right and good for you to do in the moment. Here is how we do listening for breath. It starts with just listening to breath. So take in a regular inhale, exaggerate your exhale, and let that make some noise. It's really hard to hear over a camera, but there's noise involved, right? And again, if this is good for you, stay there. Listening for breath is take in as much air as you feel satiates your need for air. This isn't as big of a breath or as shallow of a breath. It's what feels good for you. Hold, and it's almost like you're floating on top of that hold. You're going to hold not for as long as you can hold, not for as short, not for a specific amount of time, just until you feel like you're done holding your breath. Then big exaggerated exhalation, like you're sinking, 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 sinking. See if you can get all of it out and then hold. It's almost like you're floating below the hold. And I encourage you to hold it for just a little longer than you think you can. And then almost rebound into that inhale. Hold. When you feel ready, exhale. Get it all out. Hold. when you feel like you need to, and do 3 more cycles. Last one. And then just breathe. Then get your hands together, get them warmed up. Place your nice warm hands either on cheeks, throat, chest, belly, whatever feels best for you today. And then I'm also going to introduce a rock, right and left. And as you rock, because we're gonna start off with some hip release stuff today. Feel yourself rocking right sit bone, left sit bone, right bone underneath the butt cheek, left bone. And then explore, how is it different if I ask both sit bones to stay still and things above it rock? And then change your mind again, rocking left sit bone, right sit bone. And then just exploring, how is it different if I ask it to stay still? One more round of that. What is it like to rock right to left all the way through? How is it different if the sit bones stay? Now, ideally, you have your feet on the floor because we're going to play with this, but even take it up a notch. Rocking right sit bone to left sit bone. However, when I rock to the right, I feel my left foot push down a little bit more. My right foot pushes me to the left sit bone. My left foot pushes me to the right sit bone. My right foot pushes down into the floor to kind of push me over. Left foot pushes me to the right. Right foot pushes me to the left. Here you can probably feel, instead of just rocking bone to bone, when I push my right foot down, I kind of feel my butt cheek, my hamstring, some muscle contract. Last 6 and 5 and 4 and 3 and 2 and 1. Find your center. Rocking now in your chair, kind of sit bone in front, or pubic bone in front, tailbone behind, right? Tailbone is the base of my spine. Pubic bone is how my hips come around to the front and have kind of that the connection point in front, pubic bone. Tailbone, pubic bone. And I don't care here if it's a rock, if you're just weight shifting, it doesn't matter. We're just kind of moving in the seat a bit. Now, you can notice this movement from the perspective of moving towards the pubic bone, moving towards the tailbone. Or you could think of your, like if you put your hands into your hip creases right now, right? And like this is the hip crease. The hip crease closes and opens, closes and opens. So here's the invitation to kind of feel this movement happening in your hip joints, where that femur, the top leg bone, fits into the kind of round hole of the hip joint. And can that feel a little more greased up, right? Like a rusty door that has some WD-40 on it, right? Like you're just kind of lubricating that joint. Not trying to effort, not trying to push, not trying to do too much. It's just how much looser can that joint feel? Last four and three and two, one more. Now I'm going to adjust the angle of my camera so you can see hips just a bit more and you get a better view of Bob over here. Okay, moving my chair back. And I'm going to sit forward on the edge of my chair and I'm going to pull my shorts up a bit just so you can see skin here and you can kind of discern what's happening. So I'm sitting at the front edge. My feet are approximately, I don't know, 12 to 20 inches apart from one another. My feet are on the ground, and I'm going to, in fact, let's bring this down just a bit more. I'm going to bring my knees together, and my knees are going to open up. Knees together, knees open up. I want my feet to pretty much stay flat. I'm not going to force them. I'm not going to squeeze them. I'm not going to require anything, but it's an encouragement to kind of um, keep the feet down a bit. And I'm just going to let my knees kind of open and close, right? Your inspiration here might be like the visual of swinging on a swing set or swinging on a porch swing. Like it's not a lot of effort. I'm just kind of moving my knees together and my knees open. Now I could move a little slower. I could also move faster, but I'm just kind of swinging the legs a bit. As you do that, see if you can put your hands on your upper belly, your low diaphragm area. So kind of where your ribs and your belly meet. And see if that area can kind of sink or soften, even if it kind of like slumps your posture a little bit. No need to keep anything erect. You're not efforting here. Now, if this feels therapeutic and good, right? If it feels like, yep, this is where I should be, stay here. Or bring your feet a little closer together. And this is going to feel a little different here. Again, I'm not like willy-nilly through the feet. My feet are relatively down, but I'm not forcing them. I'm not squeezing them. If they need to come up a bit, I'm okay with that. My feet are pretty much flat on the ground. My right one, because my right hip is always a little tighter. When my knee opens up, my right foot wants to open up a little bit. I'm not letting it like sloppy, right? It's more or less down and it kind of comes up a bit, right? I'm not letting it fully do that. And I'm also not like overly efforting through an ankle or a foot. And my feet are more or less pointed straight forward. They could point out a bit if that's like if it's a little bit of a V or straight. Again, this is really for you to decide what feels good, what feels like a lubed up, well moving joint here. Good. We have lots of hip pain, but this one feels good. Good. This is also really good for something we tend to not talk about a lot in movement classes or embodiment classes, which is pelvic floor health, sort of the inner lining and the muscle and the fascia inside of the pelvis. And that's important for both male and female health. And so, whether we're talking pelvic floor, we're talking prostate, we're talking anything with pelvic floor, movements like this are really, really good for that. Now I can stay here or I can pick a third location. I might want to open up a little wider. I might want my feet asymmetrical, meaning right foot a little further away from me, left foot. It's for you to kind of determine. I'm going to go wide and I'm going to go through this. Again, part of it is like that relaxing. If you've been with us the last few classes, you may also want to be doing the right sit bone, left sit bone widening meditation here. Another 15, 20 seconds. If you're like, oh, I really like this, this feels good, doing this throughout the day in like 2 minute increments, really, really good for people who find themselves sitting a lot. It's just a way to kind of relax, release some of that hip joint tension, and then relax. Now, I'm going to sit back in my chair a little bit. I'm just going to go back into that right and that left action. And again, I can do it from any which way. I can do it, keep it still. I can do rock right sit bone to left sit bone, or I can do push from my left foot, push from my right foot, push. So now you have a library of choices, and I don't know which one's going to feel best for you. Kind of explore and play. And then center. From there, I'm going to take my left leg, keep it down. My right leg is going to come up and over like this. And I'm going to do some rocking here. Now, for some people, this is a little too much, right? Like that hip is a little too tight. You can move the leg down a bit and get into it like this. Or you can go back to that just kind of rocking scenario. Here, again, I'm thinking both sit bones more or less equally weighted. I'm not cantilevered over, more or less equally weighted, and I'm just rocking. Tailbone, pubic bone, tailbone, pubic bone, tailbone, pubic bone. Then I'm going to find my center, and I'm just going to kind of rotate that ankle a little bit. If I want more, I can take both hands and just kind of grip on the leg a bit. And just notice as you make circles, which portion of that circle does your ankle not want to make? Sometimes it requires you to kind of slow down a bit and then reverse so that it's not how many or how fast, but it's how perfect of a circle. One more. And then release. Then let's do the other side. Take and figure out which version of this exercise makes the most sense, and then rock. So I have a question in the chat right now about clicking noises in the ankle. It can be a lot of things. Typically, it's like a tendon running over either another tendon or a bone. It's generally speaking not a problem. If it hurts afterwards, then it's a problem. And you either want to heat it or ice it and kind of slow down. Sometimes, and this is what I'm saying about slowing down. So if I'm to do this side, right? Typically we kind of want to move like fast, but sometimes if you slow down, you can feel like right before it wants to click and make an adjustment there. Maybe you're doing something weird with your toes or weird with your heel or weird, like as it goes through here, maybe you're lifting through something and it gives you an opportunity to kind of slow down and be present with what is my body doing here that is causing a click. And you don't need a kinesiology degree to figure that out. You just need to kind of slow it down and see if you can avoid the click by making a different choice. Reverse the circle if you have not. And release. From there, let's just go back to a little bit of this. I see in the chat someone has brought up a question about Achilles tendons injury and recovery and stretches. I would not be doing stretches probably. And again, Achilles tendon injury is a very big category. I don't know that I would default to stretches. I would probably default to heat and ice and kind of using those. I would default to rolling out with maybe a like racquetball or something very, very, very soft, rolling out my foot. Here's what I'll say. Lacrosse balls and feet, do not. Ping pong balls and feet, do not. A frozen water bottle for your feet, do not. Your feet are going to respond best to something that is kind of squishy and tactile. So thinking like a racquetball and kind of rolling out the feet. It could even be a pillow and kind of massaging through that. Sand, um, grass outside, anything that has some movement, some resistance, some like soft give to it. I would be doing that. And then I would be doing some of these ankle circles and then maybe getting in there and massaging some calf. And that is how I would approach a general Achilles tendon thing. So we did these, we did some rocking, we did some stretching. And so now the invitation is to just find somewhere that you can kind of sit comfortably and then let's kind of just move a little bit. We're going to get more into what I'm talking about, just moving here a little bit in the next 6 week series that I believe starts in like May sometime. The next 6 week series that will take us on Wednesdays, that will take us from like May through June, middle of June ish, whatever that is really going to be focused on spine and back and by means of that area, also the front, so core, but not core as in strengthening, core as in sort of releasing. And what I'm doing right now is one of the strategies we'll be learning, which is sort of micro movements. Typically, we think movement needs to be really, really big and that it needs to be prescriptive, and I've got to hit this exact angle. We're letting go of all of that. We're going instead, what's the smallest little shimmy movement that I need to do? And the point of doing it right now is we've released the hips, we've kind of gone down there. And how do I need to get some of that relaxation up into my shoulders? So, what are some of these little micro movements that need to happen in order for my shoulders? When I say shoulders, I mean this area of my body to feel a little more relaxed, to feel a little more open. And that's something I can't tell you how to do it. It's almost like what you're going to do. It's I can guide you there. What you're going to do is sit, feel the width and the space in your hips and in your pelvis. And then how do you bring some of that feeling upwards? And it might require like little tiny itty bitty movements, side to side, forward and back. What do you need to let go of? What do you need to squeeze more? Maybe it's a right and left movement. Maybe like there's so many options, but it's almost like you're shimmying into comfort versus squeezing or pushing. Then maybe it goes right into your shoulders. It's like, what are some of these small little shimmying, small little movements that you need to do with your collarbone, with your shoulder blade, with your shoulder joint proper? In order for it to feel a little more spacious, a little more relaxed. Then pause. Choose a side, right or left side. Neither one's right, neither one's wrong. It's just a choice. Start to lift your arm and then bring it back down. Now, some people actually have like shoulder impingements and shoulder issues, right? Don't go above don't go above where it feels okay to go. But most of us on this call, and I'm going to even say like 85% of us on this call right now, maybe you don't have shoulder pain, but somewhere in the lift, it's either a pop, it's a snag, it feels like the tension has changed. It's a little more effort. Go to whatever that area is. Like for me, it's right there. I can do this, no problem. But right about there, things change a bit. And then I'm just going to do some of that like little micro movement. I may want to think of, and if my hand up above is kind of doing this, right? It's almost like oceanic movement. Like maybe if you're into visualizations, your hand has become a jellyfish or a sea anemone or like a blade of grass. You're just kind of moving it, pulsating, figuring out what little movements. And if that feels okay, maybe it goes more out to the side or more up above, right? It's not a reach, it's not a push, it's not mechanical. Too often we treat our bodies like mechanical robots. And instead, we're just honoring that the majority of your body is made out of fluid. The majority of your body is soft tissue. It's squishy, it's gushy. It wants to move in undulations. It wants to move softly and smallly. And this is just an invitation to kind of do that, spending some time and then setting it down and just notice any differences. And then let's explore the other side, right? It can start by just moving. And what you're doing here is you're going, where's my boundary? Where do things change? And I'm going to go to wherever that change is, and then I'm going to start to move. Inspiration here was oceanic or kind of being moved by waves. Now, for me, this side's a little bit different. It's in my shoulder, but I can also feel like an immense amount of tension, kind of forearm area. So for me, and I'm going to kind of lower my hand so you can see it, I'm actually going to kind of do some of this action up here. My body did a reflexive breath. That means my nervous system is liking this. You'll learn more about that in Adjusting to Change toolkit. Just know that if you're doing like a yawn, if you kind of feel tired or feel kind of heated and flushed, all good signs. And this is very different than what we did last week, right? Where we were working with fascia. We were working with like holding and stretching and breathing into it. This is kind of the other side of that, right? Neither one is right. I'm just giving you options, different things to kind of explore and play. Doing an exercise right is not what's going to make your hips and shoulders feel better. Getting embodied, exploring and playing and making smart choices in the moment, that's what will be helpful. And then just breathe. Start to just do that rocking right and left a bit. Now, because so much of what we've been exploring and playing with today is kind of creating space, undulations, liquid movement, oceanic inspirations. Let's finish it off there with probably one of the best exercises you can do for your entire body. I'm going to move my chair out of the way. This is going to require you to stand up. Let's see what's going to be the best angle. This will work. Okay, my feet are about as wide as my body is. My knees are kind of bent. And I'm just going to jiggle. I'm just going to go right and left. And I'm jiggling. And I'm relaxing my sit bones. I'm relaxing my hip joints. I'm letting my arms jiggle, my shoulders jiggle. Jiggle, 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 jiggle. I keep doing that, but I bring one foot forward a bit and I jiggle. And I can jiggle back and forth, back and forth. I could change my mind. Bring the other foot forward. I could go side to side here, letting my head and my neck jiggle, 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 jiggle. And then return to your seat, just so you can take an inventory going, what feels different after today? And then pick the one thing that was hard for you to do, and maybe the one thing that felt really, really good, and keep practicing those things. Join us again next week, this Friday, whatever it is. I'll check in whatever remaining questions we've got. But thank you so much for joining us. Appreciate it. If there's any more questions, feel free to drop them in. Okay, we had a question here about numbness and tingling in the hands with carpal tunnel. That can be from a vast number of things. Sometimes some of the work that we did today will help with that. Um, and there are so many follow-up questions with that. One question for you to kind of explore, whoever this is, one question to kind of explore is if you have numbness in the hands, is it the whole hand or is it kind of thumb and index finger? That's one set of nerves. Is it kind of middle fingers? Different set of nerves. Or is it kind of pinky and outside? Different set of nerves. So you've got lateral, medial, carpal, radial, ulnar, and medial nerve complexes there. Then you can kind of move and explore and play. There's some nerve if you have that happening, and again, this is sort of not exactly where we're headed in this sequence, but you might want to look up what are called nerve flossing movements. Nerve flossing movements. Flossing like you floss your teeth. Nerve flossing. Then sometimes they're called nerve floss stretches. Sometimes it's nerve flossing movements, but there's some that kind of open up and stretch some of those things. Um, that might be helpful. The other thing is just making sure that these two bones are rotating around each other. And sometimes that just is some massage. And then it can also be all the way up into the shoulder itself. Lots and lots and lots of options. Sorry, I can't get more specific, but there's a lot of moving parts in that. How can you get rid of front of hip joint pain? Um, pain the fastest. Some of the work that we just did will be really, really helpful. Also, to be thinking in terms of reciprocity. And what I mean by that is muscles work reciprocally. So when my bicep is contracted, my tricep has to relax. When my tricep is contracted, my bicep has to relax. Often, when we have front of the hip pain, and again, broad category, it can be from a lot of different things, generally it is coupled with like too much sitting or too much hip flexion. And hip flexion means hips at 90 degrees or less. So those muscles get short and tight. And then the back of the leg muscles, the hamstrings and the butt cheek muscles, get long and kind of relaxed. So doing more things to strengthen hamstrings and butt cheeks are typically the fastest way to get rid of hip joint pain in the front. Also, because it could be connected into psoas, which is muscle that connects upper body to lower body, again, going down the rabbit hole, but the jiggling and the swaying, best ways to release all of that. So try some of the stuff and keep diligent about some of the stuff we did work on, and also work on some glute strengthening exercises and some hamstring strengthening exercises. Low back pain. We'll get into that. We'll get into that next series. Low back pain will be in the next one. Okay, everybody. Thank you so much for the low back pain. Make sure some of the work that we just did will be helpful there, but make sure you join us for the next 6-week series where we'll really, really kind of dive into back stuff. Have a great rest of your day, and I will see y'all soon. Bye, everybody.